Hello everybody, today we are at Equine Hospital of University of Helsinki and we will see around how it works and we will meet a very interesting person. Follow me. Can you present where you are, the clinic?
Yes, sure. So we are currently in the clinics of the Equine Hospital of University of Helsinki. We are at the Faculty of Veterinary Medicine, and our hospital is actually the only veterinary teaching hospital in Finland. And moreover, we are also the only equine clinic in the country that is open 24/7 all year long. So we are the hospital that mostly admits emergency cases. And then cupboards with all the necessary supplies that we need. So this is our main examination room. This is our second examination room, and we use it mostly for ophthalmology cases and for dental cases. So as you can see here, we have oroscope, so the camera that we use to check the inside of the mouth of our patients. This side is like dental side, and this is ophthalmological side. All the necessary equipment is usually hidden, so we keep it clean and safe.
Yeah,
if anything.
of course.
Yeah. Radiology room. So as you can see, we have the X-ray machine here and all the necessary gowns, and then behind this wall there is the computer with all the programs and equipment that we need for it. And so whenever our patient needs a diagnostic imaging, as in radiographs, then we bring him here, and this is where it's happening. And then others can safely observe from behind the wall, so they are not exposed to radiation.
Yes, yeah. Like radiography for humans.
If you need to cross with one horse and then with the other one, you need to have enough space because they may also not like each other. This is our surgery theater. Medications down on the floor using this rope, and 3 people are assisting the horse to get safely down. And then using this machine, we can transport the patient to our surgery theater. So we need here at least always 3 people managing it. So this is our first surgery room. Behind, on the other side of this wall, we have a surgery room number 2 if there is a need. So as you can see, this is our table that we use for various procedures. Our anesthesia equipment and all the necessary medications and surgical materials, suture materials that we have here close by. I don't know if you had any chance before to see a different.
At veterinary school of Toulouse, I have a chance to see the surgery room.
And this is pretty similar. It's just like the mirror reflection from the other side of the room.
When you need to take 2 surgery at the same time,
then we have technically a possibility. We have 2 rooms and 2 anesthesia machines. It does not happen often though, but if there is a need, there is a possibility to do it. This is where we do the induction on the patient, and then after the surgery is done, we lift the horse again up to this side. So as you can see here, we don't have this wall or door because it would be unsafe to recover a horse in such conditions, and this is a bit round and softer walls.
It's comfortable.
So when the horse is first, he is being assisted, and then when we already extubate the patient, it just slowly, hopefully, gets up here, and it's constantly being monitored by our nurses and veterinarians. The rooms where the surgical equipment is being cleaned and things like this.
Okay.
Also, we use it in everyday life to explain things to students, and for example, when the horse has orthopedic evaluation, show on the real bones where was the injury that was found, or if there is, for example, an injection performed, then it's easier to, you can just spot with your finger what was wrong. This is our third examination room. We also use it for like general practice or most of the procedures like gastroscopies, endoscopies, ultrasonography evaluations are being performed here because we usually leave our ultrasound machines here, and in the cupboards here we have all the towers for different endoscopes or scopes in general, gastroscopes, endoscopes.
You have all patients here.
Yeah, all patients are inside some evaluations and they are not hospitalized, so we call it like polyclinic patients. And if they need to stay, for example, I think this horse will leave home today in a couple of hours. This is our isolation unit. So actually to enter these boxes with a horse, we would have to go from the outside. So whenever we have infectious patients, they are being set here.
Human.
Change. And then we go through this door, there is the box, but the horse comes from the outside because the purpose is so they don't walk through the stable with the pathogens.
Yes.
That is used by farriers here. You can see
very
all
nice.
different kind of shoes, not used, but twice a week there is a farrier coming and they have the clients here. So they have this larger stock, and this corridor is used when we have lameness evaluation. So when you need to trot the horse,
Okay.
or walk.
We will start with the first question. What about your background? Can you present yourself, please?
Okay. Yes. So my name is Katarzyna Kut. I am an equine veterinarian. Originally come from Poland. And I've been working as a veterinarian for 2 years now, and here in Equine Hospital of University of Helsinki I'm working as an intern.
Okay.
Yeah.
Okay. And you do some kind of other things before to go at the hospital at Helsinki? You work at other hospital?
Before I actually worked in a different clinic. I was also an intern at the clinic of Estonian University of Life Sciences.
Yeah.
In Tartu.
Okay.
So after completing this internship, I came here to Helsinki.
Okay. Yeah. Very nice part, of course. Why did you choose to become an equine vet?
So it was a little bit of a plan since the beginning of my studies of the vet school. But then before, since I was a kid, I wanted to work with horses. I just didn't have really much of an idea what exactly I would like to do. I was riding horses as a kid, but I was never a professional rider. And an idea of veterinary school just came up to my mind and I decided to stick to it, and then here I am.
Okay.
Yeah.
Okay, very, very interesting. I think I would like to ask you this question because I think it's a dream of a lot of little girls to become a vet, and for me it's an interesting question.
Yeah.
What is the best part of your job?
I think the best part or the best moments are when we get to treat and then send home safely our patients, especially those that were admitted with serious conditions and require intensive care and intensive hospitalization. So those cases bring more satisfaction when we can see them back with their owners happy at home.
The happy end
Yeah.
of all patients.
Yeah.
What kind of advice you can give to the people who want to become an equine vet?
Okay, so what I would say to the students, mostly. Okay, so first of all, stick together as a team and support each other. Practice as much as you can, because then in the near future, those experience that you gain in the vet school will be very valuable for you. But also, do not worry too much. Because I know many veterinary students are really stressed about graduation and starting work as a vet. But it will be okay. When the time comes, you will manage. So.
Okay. Maybe have more practice if you can. I don't know if.
I think it's always great to go to different clinics to also see different point of views, different perspectives. But then the main. You will actually start practicing when you will become a vet. And then this is the part where the things that may seem like very difficult for you now, they become clear when you do them in everyday life.
Okay, yeah of course.
he will not let us.
Very funny horse. And we go to the end question. What do you think is the definition of happiness up to you?
So I think the happiness is the a state where we can reach, where we are able to do to achieve our goals, when we are able to do things that bring us purpose and satisfaction. And I need to say that for sure being an equine vet is one of the aspects of my life that brings me happiness.
Okay, yes, of course, yeah. It's most important. So thank you very much for your time.
Of course.
For your for all to visit your very nice clinic.
Yeah.
Thank you very much for your time. Thank you.